Okay, let's get right into it. Today, we're doing a deep dive into something that's super important, but maybe a bit overlooked. The liver blood test.
Exactly. And we're going to look at this through the lens of local services, specifically how options from, say, Blood Test UK can make a real difference for people in places like Hemel Hempstead.
Right. So our mission today is pretty simple.
We want you to know what these tests check, why catching things early is so vital, and, how just using a local clinic can be a huge health advantage.
So let's start with the basics. Why the liver? What's the big deal with this one organ?
Well, the thing is, the liver is incredibly quiet. It's your body's main processing factory, but it doesn't complain or cause pain until the damage is pretty far along.
So a blood test is basically a way to check if the factory's running smoothly.
That's the perfect analogy. And the Blood Test UK guide lays out the key things it checks for. Markers like ALT, AST, bilirubin, a few others.
Okay, that's a lot of letters. Let's make it real. What does something like ALT actually tell a doctor?
Let's focus on ALT and AST. Think of them as leakage enzymes. They're supposed to stay inside your liver cells.
Okay, so they're locked away.
Right. But if those cells get damaged by a virus or inflammation, anything really, these enzymes spill out into your blood. High levels are like a smoke alarm going off.
A smoke alarm. I like that. So what are the first signs that you might even need to check for that smoke?
One of the clearest signs is jaundice. That's when your skin or the whites of your eyes start to look a little bit yellow.
And another one mentioned is just feeling tired all the time.
Yes, but a really deep chronic fatigue, the kind that sleep just doesn't seem to fix. If you feel that, it's definitely a signal to get checked.
So let's say those signals appear. What's the actual test like? Is it complicated?
Not at all. It's a standard blood draw. The technical term is venipuncture.
Which just means a professional uses a sterile needle to take a small blood sample from a vein in your arm.
Exactly. And that sample goes right to a local UK lab for analysis. The whole process is very quick.
How quick are we talking for results?
You're usually looking at somewhere between 24 hours and maybe 4 days. It's a fast turnaround, which is key. You're not left worrying for weeks.
Now, there's a really crucial part here about preparation. The sources say you have to fast.
Yes, this is non-negotiable. No food for about 8 to 12 hours beforehand. And just as important, no alcohol for a full 24 hours.
Can one meal or one drink really mess up the results that much?
Oh, absolutely. It can significantly distort them. Food and alcohol directly affect markers like GGT. Fasting ensures we're getting a true picture of your liver's baseline health, not just what you had for dinner.
It prevents a false alarm, basically.
Precisely.
So let's zoom out. Why is local testing so important? We've talked about early detection in general, but why the focus on, say, Hemel Hempstead?
Because convenience is a massive factor in proactive healthcare. If your clinic is local, like the NHS-affiliated ones mentioned on the Blood Test UK site, you're just more likely to go.
Less travel, less hassle.
It removes barriers. And that means you get tested sooner, and if there's an issue, you get care sooner. Time saved is often health gain.
That makes sense.
Yeah.
Is there an advantage to the lab itself being local?
I think so, yes. Local labs and doctors often have a better feel for the health trends in their specific community. They might have more context for your results, which leads to more tailored and sort of smarter healthcare.
So it's all about making preventative care easier and more effective for the community.
Oh, that's the bottom line.
Okay, so the big takeaway here seems pretty clear. A liver blood test is a simple, local step that can catch potentially huge problems before they start. It's a powerful tool for staying healthy.
It really is. And since the best approach is to track your liver health over time, that leaves a really important question for you, the listener.
What's that?
What risk factors in your life? Maybe it's your family history, maybe it's lifestyle choices. Should you be discussing with your doctor to decide when is the right time for you to start monitoring your liver health? That's the conversation to have.